Hi, everybody. My name is Margaret Tall, an ophthalmologist of California, physician and surgeon. I thank God for the privilege of sharing this very important testimony. I have my husband, who also is a surgeon and physician in California, working at an urgent care facility. On January the 1st, he had 70 patients who registered to see him and his assistants for COVID testing. Out of the 70 patients, 30 came back positive, tested that day. Unfortunately, my husband came home with the COVID virus for himself and also gave it to me. He was pretty sick, but his test results was not available until the 4th or 5th day. On January the 7th, the 8th, and the 9th, he was in the emergency room, isolated in tents in front of the hospital, and tested every 1.5 to 2 hours for the doctors, for lab tests, for x-ray. His x-ray was taken, but report was never given. His oxygen level was still so-so, so he was not meeting the criteria to be admitted. The second day, he was given an monoclonal antibody injection and was sent home. The third day, he got so sick that I took him again to the emergency room. A total number of patients and perseverance hours were spent for him in the tent and for me outside in the cold. On the third evening, he was going to be discharged, but my knowledge and my sense say that my husband should not be discharged, so it was almost against medical advice to be admitted. So it took them about 10 hours for him to be admitted in the hospital. He got very sick, and had a temperature of 102, and his oxygen level was dropping to 86 or below. He was then given 10 liters of oxygen inhalation with a nasal cannula, and even standing up to urinate is a hard chore. Oxygen level keep on dropping, and he felt very tired. Through the care of the specialists, infectious disease doctors, and their nice management and treatment, they gave him the albuterol inhaler, including steroids and also some newly approved rheumatoid arthritis medication used for 1 or 2 days that will decrease his level of oxygen need, and he did improve. He also was unfortunate to have black stool called melena due to his many medications prescribed by his provider prior and during the hospitalization. Thus, he was monitored 3 days for his stool and all become negative. Then he was put back into certain medications which were mandatory and necessary. He finally pulled through this without being given the respirator to survive. He have less energy and take him longer time to recover because he had never used the PEMF prior to this hospitalization or his sickness. As for me, I have total hip replacement about 17 months ago, and I was a consistent person using the PEMF machine to increase my circulation and help maintain the growth and the wealthy being of our tissues in my body. So we are so fortunate to have two IMRS PEMF machine at home, that this is a very important holistic therapy at least 3 times a day for myself when I was self-isolated and self-quarantined at home to help me pull through this COVID. Thus, I was mildly affected with COVID, and my lung x-ray was never told to me when it was taken in the hospital at the emergency room that shows some infiltrates in my left lung. So this PEMF is a definite adjunct and supportive therapy for people who are afflicted with COVID, because that increase the oxygen supply and decrease the blood clots to happen, which is part of the side effects of COVID. This, in the long run, if blood clot happen, can cause embolism to the lung, to the brain, to the heart, and that is not too good. So I definitely want to thank for this privilege to use this pulse electromagnetic field, and I totally recommend this holistic therapy for people who listen to this testimony and also make good use of it to have a better life, a happier one, a healthy one. God bless.